From a very young age, I've been exposed to death and grief, whether it be close friends that passed away with overdoses, car accidents, my brother's suicide when he was 37. My dad had cancer, my mom had cancer. Both very different journeys, very different hospice experience. They were both under hospice. With my dad, very much like the other deaths and grief and the loss that I've experienced, we didn't really talk. We didn't talk about what was going on. My dad and I did not have that connection to talk about how are you feeling, how am I feeling, what is happening. Even though I was there with his last breath, it was a beautiful moment. There wasn't a lot of closure there. With my mom, I've been working with Hospice of the Chesapeake. I was able to really give my mom a beautiful ending, and we completed our story and her life with I love you, I forgive you, and I'm sorry. And that was really a difference from my experience with my dad. And I would love to help other families be able to have that type of closure, because it's not just the physical body, it's also emotional, mental, and spiritual. Courageous conversations are on a daily basis in the community, whether it's the partners that Hospice of the Chesapeake works with, whether it's the family members, the patients themselves, the doctors. It's endless. And there's so many more conversations that need to happen that are not, because we need to start upstream and having some of these conversations earlier so it doesn't happen in a crisis situation. But I am very grateful to be a part of somebody's journey and being able to embrace their conversations, what their story is, what they're going through, what their feelings are, what is next for them when their loved one is passed. There's a lot to courageous conversations that I feel like we need more of. Endless things keep me motivated. The underutilization of hospice in Maryland and U.S. as a whole. There's a lot of conversations to be had about end of life. Also, I have a growth mindset, so it's the continuous learning, the continuous partnerships in the community. I'm learning from Hopkins and their palliative team all the time. I learn from the nurse practitioners in our community, the providers, the doctors, our team here, my team that I work with. It's constant conversation, constant growth, constant learning. My kids being happy and successful with their families, my grandkids, gardening barefoot, plants. I love my plants and flowers, my fish tanks. Life in general brings me joy. 45 years is such an accomplishment. It's so exciting. And in the next 5 years, I see, since I've been here for 2 years, I see that Hospice of the Chesapeake has grown in circle leadership, not only inside Hospice of the Chesapeake, but also in the partnerships in the community. And then just to continue the transdisciplinary model of continuing to educate either in HOC or in our partnerships in the community.